Let's define what amenorrhea actually stands for. Amenorrhea is a situation when a woman that has already established her menstruation suddenly stops having periods, regular periods. That is from young women till the age of menopause. So we have many stages of amenorrhea and many actually ages that can happen amenorrhea to a woman. So the most important part is to define which age is the woman that's suffering from amenorrhea, and after that to approach about the reason that she is producing amenorrhea and how we can help her about that. There are multiple causes, so we need to define the age of the person that comes to your office having amenorrhea. They have the young girls group, we have the middle-aged women, and we have the women that actually reaching menopause. So let's start about the young age group. The amenorrhea to the young girls, actually it's very often. It happens because sometimes the axis from pituitary gland and ovaries, they are not growing well and they are not mature enough. So a young girl can have the first menstruation in some age, around 12 or 13. After that, she can stop and not having period for a couple of years. And when the axis is actually matured, we can have again the period. About the middle-aged women or the women after adolescence till the premenopausal state, the reasons of amenorrhea, there are plenty and they have many causes. The first one is the hormonal disbalances. Sometimes if a woman has polycystic ovarian syndrome, can cause excess of androgen, so she can have amenorrhea. The second one is if there is a cyst in the ovaries that actually produce some hormones that alter the stage of the hormone balance, then she can have amenorrhea. The other thing is sometimes we have amenorrhea after pregnancy. This is a very serious situation and we need to have a very good history past. When the amenorrhea started, how long she has regular periods, if she has abnormal periods in any stage of her life, and to have the right laboratory test and of course an ultrasound. And of course we have the group of perimenopausal women and menopausal women that actually in some point of a woman's life after usually the age of 48, she can have irregular cycles. She can have periods with no menstruation for 6 months, 7 months, even 1 year, till actually the ovaries stop working at all and we are going to go to menopausal state. During lactation, the dominant hormone is progesterone. If you have high progesterone levels and low estrogens after the birth, actually the result is not having any period. But have in mind that no period doesn't mean actually no fertility. So the women that they are on lactation, they have to be very careful about contraceptive methods because high progesterone levels can cause high infertility rates. So be careful about that. Use a contraception method if you don't want to have a pregnancy right now. Of course, there is a cure for amenorrhea and there are actually many treatments about that. Depending on the cause of amenorrhea, let's start a little bit backwards. Let's have first the menopausal women. Can we actually restore the period in a woman that's going through menopause? Yes. And how we can do that? We can use hormonal replacement therapy treatments. Nowadays, we can use bioidentical hormonal replacement therapy because they are more safe, more accurate, and actually what is the difference between the oldest ways of hormonal replacement therapy and bioidentical hormone replacement therapy? The bioidentical hormones, actually they are just unlike the hormones that our body secretes. So the harmful of these hormones, there are actually none. because it's natural, they are doing the same job, and they don't have side effects. For the young girls, depending of the situation that causes amenorrhea, maybe it's the maturity of the axis, maybe there is a cyst, maybe there is a lot of stress, so we need to find the reason about that. If we have access of androgens, we can reduce the access of androgen during the treatment of contraceptive pills. If we have stress, then we can tell to our patient how they can tolerate with the stress. Or if we have immaturity of the axis of pituitary glands and ovaries, then we can wait, the first thing, or we can restore the period of a young girl, giving her contraceptive pills. For other reasons that affects amenorrhea, suddenly amenorrhea through all other ages in women, we can identify the reason. There is a hormonal disbalance of probably thyroid gland. There is excess of androgens. There are cysts in the ovaries, or we can have even Kallmann syndrome, that is something happened after labor. This is actually the worst stage of amenorrhea, and actually we cannot restore the period in these women. But actually, if you go deep enough with a good family history, a good patient history, a good laboratory test, and a very good scan, for sure you can find the reasons, and according to that, you can give the treatment to the woman. The only thing is you need to find the cause. This is the important part.